Millions more doses of coronavirus vaccines could become available after President-elect Joe Biden takes office. A spokesperson says Biden wants to release nearly all available doses. Aides say the president-elect will share more details of his plan next week. The Trump administration has been holding back half of the available doses to ensure second shots are available. This comes as cases continue to surge across the United States. For the first time yesterday, officials recorded more than 4,000 COVID deaths in a single day. More than 11,700 people have died in the last 3 days. Nationwide, Johns Hopkins is reporting more than 21 million total cases. California, Texas, Florida, New York, and Illinois have all surpassed the 1 million mark. Let's bring in Annette Reboli now. She is a professor of medicine and dean of Cooper Medical School of Rowan University. Dr. Reboli, thank you so much for joining us. We really appreciate it. So these numbers that we've been seeing over the past week, these enormous numbers, are they due to the holiday surge that public health officials were warning us about earlier? And how are hospitals handling these current numbers and preparing to deal with potentially more?
So yes, some of this is the holiday surge. We had the convergence of Christmas holiday, and we also had New Year's. So we are seeing upticks in cases caused by those. But there's also the element of the seasonality of this virus. So we're solidly in the winter months now with colder weather, with more people going indoors. In California, for example, this surge that they're experiencing, this devastating surge, was predicted by some modeling that was done in the fall. Overcrowded conditions, a lot of people who are essential frontline workers who have to be out and about. So there's a convergence of all of these factors that contribute to these surges that we're seeing right now in different parts of the country. With regard to capacity, yes, in some places where there are large numbers of cases and large numbers of critically ill people, the ICUs and the hospitals are being strained. We're seeing that certainly in California and Southern California. In other areas where the situation is relatively quiet, we are not seeing that.
And Doctor, the vaccine rollout continues to be frustratingly slow. So far, about 5.9 million people have received a shot. What do you think we need to do to ramp up these efforts to get the vaccine in the arms of more people? And do you agree with this idea that we should rush at least the first shot, even if we can't get the second shot? What do you think needs to be done?
Well, let me address the first part. So far, about 17 million doses have been pushed out to the states. Of those, the uptake has been about 5 million. Now, of course, there is a supply and demand issue, but I think one thing that has to happen is as we enter these different phases, and each state has taken a variation on the CDC guidance. So when the time comes to get vaccinated, we need folks to come forward and get vaccinated. I think that that's the first part of it. With regard to whether it's prudent to offer just the first dose and then see what happens for the second dose, there are currently studies underway. And I think we should see what the effect of that is. That might be an effective strategy depending on the vaccine product. But right now, I think as folks come forward, and I think that the states should move through these phases quickly. If they're not getting uptick in one phase, they should move on quickly to the next. It's about, as you said, getting shots in arms.
And Doctor, as we mentioned earlier, President-elect Joe Biden is announcing plans to sort of break with the Trump administration's vaccine distribution plan. So he wants to release all available doses when he takes office. Can you talk a little bit more specifically about the pros and cons of doing that? I mean, is it better to get at least one dose into as many arms as possible, or do we really need to make sure that whoever gets the first dose gets the second dose before we start giving anyone else the first dose?
So I think a strategy like that depends upon the efficacy. So if a vaccine has very good efficacy after a first dose, then depending upon the situation in a given area, if there are a lot of cases and things like that, then yes, that's a very effective strategy of pushing this out and getting as many people vaccinated as possible. But there are other effective strategies. And I said right now, 17 million doses distributed, but only 500 actually 5 million actually administered. So I think right now we're not getting as much uptake by those who are in phase 1A that we should be seeing.
And doctor, of course, as COVID cases surge, more and more people want to have access to testing. At-home coronavirus test kits are something that a lot of people have been waiting for. Apparently, they are here now. They are available to buy online. They're not cheap. I've seen some for about $100 a pop. But what can you tell us about the online at-home kits that you know about? Are there concerns about people testing themselves instead of by a professional?
So I think that these rapid at-home tests can be great game changers, quite frankly. And you do your sampling in the comfort of your home. You don't need to travel somewhere, which is desirable if you think you might be infected. You can also self-isolate very, very quickly. So that becomes a very, very effective way to do this. They're almost like home pregnancy tests, in that regard. The issue, though, is depending upon the type, their sensitivity is not as good as the molecular tests. Most of these are antigen-based. It's not as good. So if you come up positive, that's one scenario that allows you to quickly home isolate. If you come up negative, that means that if there's a high index of suspicion that you might be infected, you need one of the molecular tests. And they are not a passport. You still have to use your mask. If you come up negative, that doesn't mean that you can't take precautions and be careful. And these are great. These are indeed a game changer. The other thing is the results are only as good as the sample. So you have to be sure that you follow the directions precisely and take a good sample.
Right.
Sometimes.
All right. Well, Dr. False negatives, of course. Well, Dr. Annette Reboli, thank you so much for joining us. We really appreciate you sharing all of your medical expertise with us.
My pleasure. Thank you.